Hi class, I'm going to do a quick overview of cat veins. In another video, I'll go over cat arteries. This is a picture that I took from your lab, hit list. And again, these are veins that I'm going to go through that are above, superior to the diaphragm. On the face region, we're going to see a vein coming down the side of the cat's face. That's your maxillary vein. The lingual facial vein will be basically how it says. It's under the cat's mandible, goes up under the tongue. There's a vein that cats have called the transverse vein, transverse jugular vein. We humans do not have that vein. So the lingual facial, the maxillary, transverse jugular vein, they are going to converge into the external jugular. More medial to that is the internal jugular vein. And this transverse scapular vein looks like it's the cat is wearing suspenders. It's coming over the cat's shoulder, and it dumps into the external jugular vein. Over here in the cat's arm region is the brachial vein, and then in the armpit region it turns into the axillary vein. When you see the subscapular vein dumping into the axillary vein, after that point the vein's name turns into the subclavian vein. Once you see the external jugular join the subclavian vein, then that is called the brachiocephalic vein, and you have a right and a left. On the lab exam, you will have to tell us if the vessel is a vein or an artery, and you will have to tell us if it's a left or a right, as it would if it applies. So for example, there is no right or left superior vena cava, so that would not make sense. You're going to see two veins dump into the superior vena cava, and those are the vertebral veins. The internal mammary or thoracic vein, there's only one. There's no left or right. It's just one internal mammary thoracic vein. And it's going to look like it's cut off in the cat pictures that I have, because it's draining blood from the cat's chest wall, and obviously the chest wall had to be removed to see these veins inside the thoracic cavity of the cat. So it's going to look like it's a vein that is coming from nowhere, basically. On the side of the cat, traveling along the vertebral bodies, is the azygous vein. I'll show you a picture of that. And don't confuse that with the large vein that you will see that's traveling in between the lungs, called the inferior vena cava. The inferior vena cava is going to be seen both in the thoracic cavity as well as in the abdominal cavity. So here is a very nice cat picture. We can see right here is the lingual facial vein. Over here is the maxillary, and you could see the transverse jugular vein dumping in, and that then creates the external jugular vein. More medial to it, shown here, is the internal jugular vein. Coming off over here is the transverse scapular vein. And again, over here in the cat's arm would be the brachial vein. This is the axillary vein. You could see it traveling in the cat's armpit. And this vein coming off the subscapularis is the subscapular vein. When you see the subscapular vein dump into the axillary vein, then its name changes, like I said before, into the subclavian. And when you see the external jugular vein dump into the subclavian, then it's called the brachiocephalic vein. So these are all the veins that would be on the left side of the cat. There would also be the same veins on the right side of the cat, but this picture is only showing the left. Here is the left vertebral vein, and you could see a little bit of the right vertebral vein. And then here is the superior vena cava. So here it is again. And in this picture, I have more of the veins labeled for you. And when you take your next lab exam, I will have these pictures of the cat, and I will basically point to a vessel and ask you to identify it. So for number 1, you would say left brachiocephalic vein. For number 2, you would have to say right brachiocephalic vein. And then over here is the vertebral. Hanging off the superior vena cava would be the one singular internal mammary vein, which it's difficult to see on this picture. I have a better picture of it for you in just a moment. And up here again is the transverse scapular vein. So another cat picture, we can see the right external jugular vein, the right internal jugular vein. Over here would be the left internal jugular vein and the left external jugular vein. When that external jugular vein dumps into the subclavian vein, then that name of that vessel is now becoming the brachiocephalic vein. So here's the right brachiocephalic vein and the left, and here again is the superior vena cava. Cut off and difficult to see is the internal thoracic vein. In this particular picture, we're not seeing the vertebral veins that I showed you on the previous slide. So here's a better picture of that unpaired, so it's just singular internal mammary vein. It's just kind of hanging out there. Remember, it would have been draining blood from the thoracic wall. Up here we can see the external jugular veins. So here's the left external jugular and the right external jugular. When it merges with the subclavian vein, it then turns into the brachiocephalic vein. This picture is not showing us the vertebral veins. They're probably deep underneath this superior vena cava in this picture. Here is another view of the cat. We can see the maxillary vein and lingual facial vein, like I said, going under the cat's tongue. And then we see the transverse jugular vein. And when all those dump together into the external jugular vein, right next to it, more medial, is the internal jugular vein. Out here, we're seeing the right brachial vein, and then it turns into the axillary vein when it's in the cat's armpit region. And here we're seeing the subscapular vein dump into the axillary, and then that turns into the subclavian vein. And when the external jugular vein dumps into that, it turns into the brachiocephalic vein. Here is another picture. The cat's head is to the right up here. We can see the external jugular vein. Here is the subscapular vein dumping into the axillary, and then that turns into the subclavian vein. So that would be the left subclavian vein that I'm highlighting here. When the external jugular vein dumps into the subclavian, then that turns into the brachiocephalic vein. Here is a very good picture of the internal thoracic vein. Again, it's singular, it's unpaired, and it's been cut here because the chest wall has been removed from the cat. Now, what you're seeing here is the superior vena cava, and dumping into it, see, here's the cat's vertebrae, all right here. Dumping into the superior vena cava is this vein that travels along the dorsal aspect of the thoracic cage, and this is called the azygos vein. And all of these little veins are intercostal veins, posterior intercostal veins. Now, here's the cat's head up here, up at the top. And we're seeing a good picture of the superior vena cava coming back to the right atrium. And this large vessel that's in between the lungs here is the inferior vena cava. It is not the azygos. The azygos would be back here along the vertebral bodies, and so the lung has been pulled over to the side. We can't see the azygos in this picture. And the reason why the lungs are being separated is to show the inferior vena cava right here. So now I'm going to go through cat veins that are found below the diaphragm. And again, this is a picture of from your lab hit list. We're going to again see the inferior vena cava comes all the way through the abdominal cavity. It is created when the right common iliac and left common iliac merge. So veins converge and they are bringing blood back toward the heart. The common iliac veins are created by the external iliac vein and the internal iliac vein, which is going into the cat's pelvis area. There's also a vein that is draining, it looks like from the inguinal region of the cat. It's called the deep femoral vein. And once we cross the inguinal ligament, that vein is no longer the external iliac vein, it is now the femoral vein. And we're going to see a popliteal vein. It's coming out of the knee region, and the great saphenous vein. So let's look at some cat pictures now. Oh, I should also tell you that the gonadal veins are very unique. The right gonadal vein dumps into the inferior vena cava, but the left gonadal vein will actually dump into the left renal vein. So that's a unique presentation of those gonadal veins. So here is showing you the left renal vein. This vein above it is going to the suprarenal glands or adrenal glands, so that's the suprarenal vein. This large vein down here is the inferior vena cava, and you could see the left gonadal vein dumping into the left renal vein right there. Here is another picture. It's not well perfused with the blue dye, but I'm highlighting it. This is the left gonadal vein dumping into the left renal vein. This vein up here is the suprarenal vein. Over here is the right renal vein. And you can see the right gonadal vein dumps into the inferior vena cava. Down here we could see the common iliac veins. And this little portion down here of blue would be the external iliac vein. Here is that inguinal ligament, and anything past that would be femoral. So that's the femoral vein that I just highlighted right there. It is difficult to tell, but this is an up-close picture of the cat's pelvic region. This nasty stuff over here is the cat's large intestine filled with poo, and it's pulled out to the side so we can see the inferior vena cava. And here is the right iliolumbar vein. That's what I'm trying to show you in blue. Right next to it would be the iliolumbar artery. And then here we're seeing the right common iliac vein, and you can't see it, but in another picture going into the pelvic bowl would be the internal iliac vein, and this one out here is the external iliac vein, and once that crosses the inguinal canal it would turn into the femoral vein. So here's a better picture of our veins. Again, inferior vena cava, which is created when the right and left iliac, common iliac veins merge. Here is your right and left iliolumbar vein. And here in the middle is the median sacral vein. Right here is the external iliac vein, and deep in the cat's pelvic bowl is the right internal iliac vein. When those two merge together, we form the common iliac. Over here is the left internal iliac vein, and over here is the left external iliac vein. And again, when it crosses the inguinal canal, it turns into the femoral vein. So this over here, the question mark is asking you identify this vein, and that would be the right femoral vein at that point. Going deep, here is the deep femoral vein. And as we continue with the femoral vein, we see the great saphenous vein leading up to the femoral vein.